Hello, my name is Scott Van Niekerk from Wholistic Physical Therapy in Brewster, New York. The purpose of this video is to show you a sample of how we might teach one of our patients the method of using a self-treatment tool, which is rather effective, in this case a styrofoam roller. Self-treatment is a very important part of any comprehensive treatment program, and we demonstrate this utilizing myofascial release principles, which involve finding the restrictions, which are the tender, hard areas in your body, using the foam roller as a method of generating pressure into the body. Treatment is stationary on that area for ideally a minimum of 2 minutes. Enjoy using it, but use it at your own risk. So we're going to start on the anterolateral compartment of the lower leg, just below the knee. Utilizing body weight with your hips directly above the foam roll, and they stay there the whole time with this technique, to press down through the muscle and into the foam roll into the ground. If this is too aggressive for you, you can utilize a softer surface. This is a soft mat. If it's not aggressive enough, you utilize a harder surface, such as a hard floor. Starting out, doing this on the bed is a very gentle and easy way to do it. So, in the quadruped position, keeping the hips above the foam roll, you slowly draw the knees towards the chest, moving the roll between the knee and the ankle in this manner, searching for the areas which feel tight and painful and restricted, stopping on them and waiting. As long as you can tolerate, 90 to 120 seconds will be great. In addition, you can do this technique focused onto one side unilaterally by simply crossing the ankle. I'm focusing now onto the left side since I crossed the right ankle over the top. Or if I want to focus on the right side, cross the left ankle over, lean over towards the right side. The next technique I'm going to demonstrate is for the front of the thigh, the quadricep region. I'm going to start with the foam roll just above the kneecaps, not on the kneecaps. That's very important because that is painful. Notice how the back maintains a lifted position as opposed to sagging, which puts pressure on the back. So you can support yourself in your elbows and just gradually rolling the foam roll between the kneecap and the top of the thigh, searching for areas which feel tight and restricted, painful, stopping on them, and waiting. The next area where I'm going to treat is the iliotibial band region. Most of us are pretty tight and painful in this area. Positioning is quite important with this. The bottom leg is straight with a straight line between the foot and the shoulder. Weight is supported on the elbow. You can use this hand too for balance. The top leg is bent, foot position on the ground for balance. If the pain is a little bit too much to bear, you can actually lift yourself off the foam roll using these points of leverage. So you're going to roll yourself up and down with the foam roll moving between the hip and the knee joint, looking for the areas which feel tight and restricted, stopping when you find them, waiting for them to release. Most of us are painful in this region, and this is the most painful one of the foam roller techniques, so be prepared for it. We can treat the gluteal and the piriformis region. We simply switch the top leg over onto the other side. That angles the pelvis backwards. Instead of being with the previous one, the pelvis is stacked vertically like that. With this one, the pelvis is angled backwards, and the motion is much smaller. It's just 6 to 8 inches rolling through the gluteal piriformis region. You can experiment by adjusting your angle, looking for the areas which feel most tender, stopping on them, and waiting for the tissue to release. This next technique is for the psoas region. You place the foam roll between the pelvis and the rib cage, and all you need to do is simply mold down over the foam roll, like so. It's an exercise in relaxation, It's very difficult to do because it's sometimes painful, especially if the psoas is restricted. Might make you feel a little bit nauseous. That's okay. Just stay with it as long as you can, breathing nice and deeply. The next technique is for the back. You start out with a foam roll at the level of the respiratory diaphragm, no lower. That's important because if it goes down to your lower back, it's an uncomfortable curve over the foam roll and you could actually injure yourself. So starting at the respiratory diaphragm level, you interlace your hands, supporting your head, and you work your way up to the base of your neck, back down to the diaphragm, moving slowly. Note that the elbows are together so that the shoulder blades are pulled apart, all the paraspinal tissue and the muscles in between the blades are therefore being massaged by the foam roller. We're looking for areas which are painful. We're going to stop on them and wait. We can lean more to one side or the other if necessary. Finding the areas that are restricted, waiting for them to release. Sometimes you may feel a little bit of a pop, pop, crack, crack as your thoracic vertebrae mobilize, and that's okay. The final technique is very relaxing, won't hurt at all, should feel really great. This is a stretch that you can finish up the sequence with. The foam roll is positioned underneath the spine, supporting the sacrum and the head. The knees are bent. The first thing we do is create length through the back of our body. So by tilting the pelvis, putting it back down on the foam roll, lifting the head, tucking the chin backwards, elongates the back of the neck. So now the whole posterior aspect of our body, the dural system, is elongated. Now we place our hands out to the side, lengthening, telescoping our arms lengthways, and searching for an angle of our arms anywhere in this arc that feels good to hold on to. So, say for example I choose this angle because it feels a nice opening and stretching across the front of the chest. After a little while holding there, perhaps I want to move one arm. We don't have to move both arms at the same time. Just searching, allowing the tissue to release. In most techniques we want to breathe with the diaphragm. Well, in this case you want to actually breathe with the rib cage. Because as you breathe in, so it allows the ribs to open up over the foam roll, and you get more out of the technique. I would suggest staying here for 2 or 3 minutes as a wonderful way to finish up the sequence. So to finish, just to review the general principles of utilizing the foam roll again, think of the word moving and searching as the same word. When you're moving on the foam roll, you're searching for the restrictions. Think of stationary and treatment as the same word. When you're still on the foam roll, that's when you're treating yourself. You want to do it for as long as you possibly can. 90 to 120 seconds is an ideal minimum. Have fun with it. Enjoy.